Good morning from San Diego, California. This is Dr. David Yoder. I have with me a friend and colleague, JP Erico.
Great to be here.
JP Erico is a scientist, executive, entrepreneur, and inventor. He's one of the founders of electroCore, a company specializing in neuromodulation that has developed a pioneering non-invasive vagus nerve stimulator. JP has also recently, congratulations, published a book, The Vagus Immune Connection, Harness Your Vagus Nerve to Manage Stress, Prevent Immune Dysregulation, and Avoid Chronic Disease, available on Amazon. So congratulations on that. I know you've been working on that for a while, and this kind of segues right into our topic for today. So I'll begin with a little bit of my background and why I do what I do and why we're here today, this morning. So as a doctor of chiropractic, I had been taught through my education and schooling to, find subluxation and address that. And by adjusting the right subluxation, you would heal people, and that's all you really needed to do. Well, that kind of worked for maybe a couple of cases. And I quickly soon realized I needed a lot more in my toolbox to be able to help my patients. And so the challenging cases over the years had humbled me, but forced me, because I am also previously to my chiropractic degree was a researcher and on a pre-med scholarship. So I've always had in the background, why things happen and what is the root cause versus just giving somebody a treatment. So I love Western medicine for their amazing miracle trauma cures, no doubt. Heart surgery, brain surgery, car accidents, broken bones, incredible medicine. But the pattern that I see in my clinic is a ongoing chronic disease state where patients have so much stress and inflammation that they don't know why they got into the situation that they got into. So they'll just tell me, I woke up this morning and my neck is hurting. And so I didn't really feel confident to just say, okay, lie down on my table, let me give you a good chiropractic adjustment and you can go back on your merry way. So that wasn't enough. And then more specifically, recently, we're going to dive into a little bit of what I call a heart story. In 2019, my wife was diagnosed with breast cancer. And so we were going to create an integrative program where we would combine the best of Western medicine and the best of Eastern medicine. But I knew one of the devastating side effects was chemo brain. And I didn't know enough about neurology. So I turned to my research mind and I studied what could I do to help minimize the side effects of chemotherapy to protect her brain so she wouldn't get chemo brain. And so that landed me to some research about non-invasive vagus nerve stimulation. And so I reached out to every company in the world to see if they could send me their vagus nerve stimulator to try and help my situation, specifically for my wife. But the timing of that wasn't just my wife. The pandemic had just started, the COVID pandemic, and I no longer had patients that were safe and willing to come into the clinic, because if we remember, the world was shut down. Unless you were a healthcare provider, you weren't allowed to even go out for groceries. And it was a pretty scary time. People thought, COVID could jump off a piece of paper and attack you. So my second dilemma was, how do I address a real world concern for my patients if their top health concern is no longer fixing their spine, their neck and back, but their immune system? So I had to really re-engineer, my strategy to be able to help both my wife and shift my entire practice literally overnight. And I want to thank your company, electroCore, and your team for graciously sending me the device, because everybody else didn't. And so I began immediately working with my wife and saw really good results. And fast forward, she never got chemo brain, thank you. And my patients realized I was on the cutting edge of something that they felt safe. And so I literally was one of the few chiropractors in San Diego that was seeing patients, providing them with a cutting edge technology that was validated to support the immune system. And that's just the beginning.
Hmm.
So that's a little bit of the why of why I landed into vagus nerve stimulation as a technology to help my wife and my patients during the pandemic. So JP, I'd like to hear from you because you're as an inventor scientist, you've had a lot of different inventions yourself. What was it about vagus nerve uh, research or vagus nerve treatment that brought you closer to inventing this device? If you could share with us.
Sure. And like you, I have a, a scientific or engineering bent to the way I think about things. And so I started out as an engineer, trained at MIT as an aeronautical engineer, and then took sort of a left turn, went down to Duke University to go to law school, became fairly frustrated with that change, stuck with it and got my law degree. But while I was there, I co-enrolled over in the engineering school and did a master's degree in engineering. Stayed on actually to do PhD work, but ultimately became a patent attorney for a very brief period of time when I was recruited by my uncle, who's a world-renowned spine surgeon, to get involved in developing the next generation of spine products. During that exercise, I recognized in myself, as you sort of grow up, you learn new things about yourself. I learned that I was a pretty inventive individual, and began not only just helping my uncle get patents for his ideas, but sharing my own ideas and patenting my own things in the field. And together, he and I founded several companies, one of which went public, one of which we sold off. Another one became just a licensing company that's licensed at this point $25 billion or more worth of products. And so we took some of the proceeds from those successful business ventures and invested it into a neuromodulation company, because along the way I had been introduced to one of his colleagues who was a functional neurosurgeon, which means that he was using neurosurgery as a vehicle for implanting medical devices into the body to try to not just support the bones or enable a joint to function again, but to actually alter the biochemistry of the brain and the nervous system. He was specifically focused on deep brain stimulation for Parkinson's and essential tremor. But along the way, he mentioned to me, and now we're talking in terms of timing around 1998, 1999, he said to me, and his name is Ali Rezai. He went on to become the president of the North American Neuromodulation Society. So clearly a big thinker in the area. He told me really offhandedly, I think we were actually out skiing, and he said, anytime anybody had ever cut a nerve, and as a result of cutting the nerve, gained a clinical benefit from that, there was the opportunity to stimulate the nerve and maybe get the same benefits without necessarily damaging the nervous system. And so with that little bit of information, I felt like, what is it Steve Martin once said? He said, I know enough philosophy to know that you don't shout movie in a crowded firehouse. Um, and so, which is obviously funny, but what I knew at that point was, okay, anytime I ever see somebody having cut a nerve and gained a benefit, I'm going to think about it from the standpoint of stimulating it. And so fast forward from 1998 to 2005, I was thinking about starting this company in neuromodulation and trying to figure out what we were going to do. And I hit upon this idea after reading an article from the old Soviet Union where they had taken dogs and made them allergic to an allergen. In this case, it was egg whites. And what they did was they cut the vagus nerve in some of the animals and then exposed all of them to the egg white challenge, caused them to have anaphylactic reactions. And all of the animals that had had their vagus nerves cut survived. And so literally just putting those two ideas together, I said, let's stimulate the nerve and see if we can save animals' lives from anaphylactic reactions. And about 6 months later, at Columbia University Hospital in New York, with some research anesthesiologists, we did that. It was a pretty amazing day. I remember it was February 6th of 2006, actually. And we were the first people, I think, ever to use vagus nerve stimulation to stop an animal from dying from an anaphylactic reaction. That led to treating asthma, which was sort of a natural corollary from that. And then along the way, we discovered that we could make the therapy non-invasive. So that's where the engineering side came in. We took sort of known technology of implanted vagus nerve stimulators and we turned it into the non-invasive approach. And that's the point at which I started becoming aware of all of the different things that vagus nerve stimulation could do. And it was a very, very broad list. And when you're confronted with something like that, where one therapy seems to have what's referred to as pleiotropic effects, such broad effects, so many different systems being affected, you're left with sort of two conclusions. One, that you're selling snake oil and that it's not real. It's all the placebo effect. Or the alternative is, especially if you're dealing with animals where the placebo effect is pretty small, is that you're doing something very fundamental, something so fundamental that it is affecting all of those different systems simultaneously. And miraculously, that's what it turns out that vagus nerve stimulation is. And so along the way, I've had the good fortune to work with some pretty open-minded physicians, some not so much, but some who were both medical doctors, chiropractors, naturopathic doctors, osteopaths, et cetera. Everybody within the healthcare field sort of falls into two categories. The category that is, as you said, sort of, focusing on, if you're a chiropractor and you're just focusing on subluxation and dealing with that one tool, then, you're a hammer and everything looks like a nail. Or you're going to actually view your education as an introduction to carpentry, which is a field that has a lot more tools and a lot more things that it can do than simply whack a nail head with a hammer. And
Perfect.
you have to figure it out. And that's where integrative medicine and chiropractic medicine and functional medicine and a lot of other fields, naturopathic medicine, a lot of those other fields are moving. And I think we have to go there. So vagus nerve stimulation is a great way to get there.
Robert Becker, the book The Body Electric, did some really innovative experiments, but his experiments kind of proved that electricity is not just involved in, but the driving force in healing and even regeneration. Can you comment or expand on Dr. Becker's concepts of what he discovered in terms of your research?
Yeah, so I view Dr. Becker's work and the work of others who come at healing and regeneration and how the body functions from different perspectives. I'm going to make, I know you're a scientist at heart and you love physics, so I'm going to use the physics analogy that I oftentimes talk about, which is we have in physics this theory called string theory. And it's an amazing mathematical construct from which very fundamental equations, the general relativity and quantum mechanical theories and Maxwell's equations all sort of fit within the framework of string theory. But there are 5 different string theories, and each one of them is different in some way. And it took somebody coming from it from the perspective of what Ed Witten did, which was look at it and say, no, each one of those theories, even though they appear different from the perspective that you're looking at them, living inside them, as different, they are actually just aspects of one larger membrane theory. And so I look at Becker's work and work like Stephen Porges's work and the work that Kevin Tracy's doing and the work that other people are doing. And I look at it and I say, you are each seeing reflections like Plato's, forms on the wall. You're seeing shadows of what's real. And what's real is actually a truth that has facets. And the facets that each one of you are focused on, yes, they're at different angles. Yes, they're at different colors, but they are still part of the same crystalline structure of truth that sits at the center. And my goal is to try to find out what that is. And I'm making some progress. I think I've got some ideas that are consistent with that theme. And where I kind of land is that that the autonomic nervous system is what I refer to as sort of the master regulator of everything. And that it, along with mitochondrial function, immune function, and your microbiome, those four things: your autonomic nervous system, your microbiome, your immune system, and your mitochondria, collectively are the four pillars of everything about life. Everything from disease to health can be described using those four pillars, and that sitting atop that as the sort of the highest extending pillar is the autonomic nervous system. It controls the others. And it's pretty exciting to have that glimpse into how the body works.
Perfect. Thank you. We're going to zoom out a little bit more to the topic of self-care. So I see a pattern of burnout, physician burnout, provider burnout, whatever field you're in, you're seeing because the patients don't have so much acute conditions, they have chronic conditions. So it seems like for every patient, it requires 10 providers to keep them afloat. And that's just not sustainable for the whole system. And we know this because of provider burnout and chronic conditions. I just got some inside information that life insurance companies are actually dropping policy insured citizens, and these aren't old people, they're middle age because they're having rising chronic conditions or dying early. I mean, we're really headed for a disaster if we don't shift the model. But one of the things I'd like to be a part of to push a different direction maybe or encourage it is self-care, that if we can not just have awesome treatments, but have transformations of self-care modules, self-care concepts, self-care classes. You could say this podcast is a self-care, module. We're learning about things about how our body works and how to upregulate our body and health. How could we help somebody shift from this treatment-based model to self-care if they're not even aware that it exists? So I mean, it's a tough question, because you don't know what you don't know. I mean, I'm guessing the beginning is offering the information.
I think there's a mindset that we have in medicine and that we have in society, that we wait until there's a problem before we address it. We occasionally will do preventative maintenance in our homes. Okay, occasionally. But most of the time we wait until something breaks, and then we rush to either replace it or fix it. And there's less fixing going on these days. It's more just replacing. But occasionally, you'll paint your house. You'll do things like that. We do it with our cars. We'll take our cars in for the 3,000-mile checkup, but we don't really do that with our bodies. And our bodies are the most complicated and in many ways both least and most capable of sort of tolerating misuse and tolerating breakage. And so we have to change our mindsets away from, well, I'm going to wait until I have a problem to fix it. I think there's Dr. Mark Hyman just had a post on Instagram which said, when you have your heart attack at 70, it started at age 40. When you get diabetes at age 65, it started because of things you were doing at age 30. When you get Alzheimer's, at age 75, that started when you were 50. And it's based on decisions that we make, and decisions that are being made for us. And I think it's really great to see what's happening right now in the United States, because I think there's a global awakening that's taking place. I mean, we just saw what happened with the congressional testimony and the follow-up with the march to Kellogg's, with the 400,000 strong petitions for them to change the dyes that they put in their cereals. But I think as a larger problem, I think people are becoming aware that the chronic disease crisis in the United States, and it really is in the Western world, but it is really concentrated here in the United States, is something that's self-inflicted. And we have to change the way we think about things. We have to change what we do with our food. We have to change what we do with our exercise. We have to change what we're doing with our medications. We have to change what we're doing about our lifestyles, and the amount of time we spend on screens, the amount of time we spend sitting. All of these things are part of a deviation away from what our bodies evolved to do and evolved to survive and thrive in those conditions. And when we deviate from that too far, we end up dysregulated, degenerated, in pain, and falling apart. So
Perfect. Yeah, perfect.
Yeah, I think that's really important for us.
There's a new science research grant that started 2 years ago from a company called Tiny Blue Dot. I sent you the link to it, but they're willing to fund nonprofit or academic institutions for proving you can validate, you can shift human perception. And why I'm bringing this specifically into our conversation here is I think awareness and perception are interlinked. And so your awareness expands when your perception shifts, or also expands to consider from a fixed state to kind of a growth mind state, or from a treatment allopathic model to, wow, I actually can learn and do things to take care of myself, to heal myself. So circling back to the very beginning of our conversation with vagus nerve stimulation as electrical life force energy, how could you connect the dots between helping shift awareness, perception, motivating self-care with what vagus nerve stimulation can provide?
So that is an excellent question. And I've spent a lot of time thinking about this. Part of the reason why I have been thinking about this is that I did some work back in 2014 through 2016 over in the UK. And what we discovered was we were really started out just looking at headaches, looking at severe headaches. But what we discovered was that patients who suffered with severe headaches for an extended period of time, it was a chronic problem they experienced, were at an incredibly higher level of risk of experiencing another group of symptoms, which we would otherwise consider conditions, separate conditions, but they really were so overlapping that it begged the question how they were related. It included depression and anxiety, sleep problems, widespread pain problems, upper and lower airway reactivity problems like sinusitis and asthma and allergies, skin issues like ectopic dermatitis and eczema, and gastrointestinal problems like IBS, not necessarily IBD, but IBS. And what we discovered was that these are not separate conditions. They are not separate medical conditions. They are one underlying problem that exhibits itself in various symptoms. And when I started thinking about it from that perspective, I asked myself two questions. One is, where else do we see this problem? And two, and what's causing it? And what I found was that we do see it elsewhere. We see it when a person gets the flu. When you go to the doctor and you say to the doctor, I've got a headache, I've got a stomach ache, I'm sleepy, but I can't fall asleep, I'm sort of down, I've got a headache, the doctor's going to assume that you have the flu. He's going to assume you have a virus or a bacterial infection, and he's going to figure out whether or not you need, an antibiotic, or you need, an antiviral or whatever. The moment you say, no, but I've been suffering with these symptoms for 5 years, that's the point at which most healthcare professionals throw up their hands and, run out of the room, looking for holy water and a wooden cross. And the reason they do that is because secretly they've got hundreds of patients like that in their practice, and they don't want another one because they haven't been able to treat them. and they don't know what the problem is. And what we discovered was that the problem actually lies in a dysregulation of the autonomic nervous system. And you say, well, how does that happen? That's the second question. It's like not just where it happens, but why does it happen? And it happens because inflammation, chronic inflammation or severe inflammation, can cause your brain to begin to perceive the inbound signals as being problematic when they're not. And I describe it like this. Every cubic millimeter of your body has nerves in it. And those nerves are bringing information back up into your brainstem on a millisecond by millisecond basis, millions of bits of information. And that data needs to be processed and much the same way a large language model does it for, Siri, or, ChatGPT does it with pretty much everything. Your brainstem has to integrate that information and extract out of it some meaning. And at the highest level, that meaning typically is something like I have to go to the bathroom, or I'm hungry, or I'm tired, or my ankle hurts, or something where we perceive a feeling. But we don't necessarily know exactly what it is. We just have a feeling based on this inbound data. But our bodies and our brains are designed not to respond to everything. In fact, it's only designed to consciously respond and feel when there's a problem. Now, the way we filter out all of the inbound information and only get those signals that are getting across that barrier or across that filter because they need to get across is by maintaining a level of inhibitory neurotransmitters and control over signaling in the brainstem. And without getting too technical, basically it acts as a descending inhibition of that signal getting across. When you're inflamed, when you have inflammation for an extended period of time or a severe bout of inflammation, it degrades that ability to control those inbound signals. And so you start getting signals getting across that filter that shouldn't be there. So you start to experience pain or sickness symptoms that are really inappropriate. Now, what are some ways that we've experienced it? Well, when you're sick, things hurt. Why would a respiratory virus make your stomach hurt? Why would a respiratory virus make your lower back hurt? It shouldn't, but it does because it's degrading that filter that's there. A perfect example of how to do it temporarily is go out and drink too much alcohol. You drink too much alcohol, the next day, everything hurts. Why is everything hurting? Why is your stomach hurt? Why are you feeling down? Why do you feel all these, headache? You're feeling those things because normal signals are now getting through that descending inhibition filter and you're feeling uncomfortable. Now, what does vagus nerve stimulation do? Vagus nerve stimulation has multiple benefits. One is that it restores the expression of those inhibitory neurotransmitters. It helps to rebuild that filter. The second thing it does is it reduces inflammation. It has, through the inflammatory reflex or immune reflex, the cholinergic anti-inflammatory pathway is the technical term, it is bringing down the level of inflammation in the body, which affects those neurotransmitters, so they're related. And the other thing that happens when you're in an inflamed state for a long period of time is that it begins to degrade your mitochondria's ability to produce energy in a healthy way. And you start to produce instead reactive oxygen species and free radicals that damage the tissue, but also degrade your energy level. That's why a lot of times inflammatory conditions, ranging from rheumatoid arthritis to the flu, gives you a level of fatigue. You feel fatigued because you actually are literally not able to produce the energy necessary to maintain normal levels of activity. That's why chronic fatigue patients and fibromyalgia patients who have a mitochondrial dysfunction as a result of an inflammatory insult that has been maintained with them for a long period of time, that's why they experience such devastating fatigue. So vagus nerve stimulation, and again, this goes back to those 4 pillars that I talked about. That highest pillar that sort of is the master regulator is your autonomic nervous system, because it's able to have an impact not only on inflammation, but also on mitochondrial function. And we haven't talked about it, but also on how you interact with your microbiome so that those other three pillars can support good health. And along the way, getting back to your original question about perception, it helps with the neuroplasticity necessary so that things that used to hurt because you were suffering with fibromyalgia now don't hurt because that filter is back in place and you're changing how your brain is perceiving and processing that information.
Too zoomed in to the
Sorry, you're cutting out. Dr. Yoder? Hello?
hello.
Yeah, you're back.
Okay, perfect. Okay. So would you say that in that state of hyper focus, super awareness, without the filtering, that everything becomes too intense because the vagus nerve is kind of not being able to filter and keep you in your prefrontal cortex where you can be like an executive and just focus on what's necessary versus you're in your lower brain survival and you're paying too close attention to too much information that's not relevant?
Yeah, the vagus nerve is not the filter in and of itself, but the vagus nerve is supporting that filter, whereas your sympathetic nervous system and the release of norepinephrine, which is heightens your alertness and heightens your sensitivity, if you will, to inbound signals, makes your brain more alert to those signals, degrades the filter so that you can see more of those signals coming in, will also heighten your sensitivities, and over time will make you a more sensitive person. That's why when you talk to a person who's been through or has fibromyalgia, 9 times out of 10, and I think the numbers really are 90% of the patients have experienced some form of emotional or sensitizing trauma in their lives so that they are perpetually living in a hypervigilant state. And that hypervigilant state is not only generating inflammation and degrading their mitochondrial function, but also is plastically changing how the brain is dealing with inbound signals and how it's processed and whether or not they get up into your conscious levels where you're going to necessarily perceive discomfort, because that's the only purpose of those signals getting past the filter, is so that you become aware of discomfort. So
Can we, yeah, would that filter be the amygdala?
no, the filter is lower than the amygdala, although certainly it activates the amygdala. I mean, you get through the activation of the sympathetic nervous system, you also get the activation of the hypothalamic pituitary adrenal axis and the release of cortisol. And we all know that cortisol effects in the amygdala are, what my wife in her executive coaching terms refers to as amygdala hijack. It degrades your brain's ability to maintain a calm state. You become aggressive. Rage is easy to attain if you want, and you also lose the ability to learn. Part of the reason why people who suffer with these conditions oftentimes have a level of brain fog, and we're becoming aware that depression, actually one of the primary symptoms of depression, is actually a cognitive impairment. So that hippocampal damage or hippocampal impairment is going to impact your memory, is going to impact your learning capacity. It's when you become aware of the science behind what's actually happening, it becomes relatively easy to identify people just simply by interacting with them, to identify those people who are in that sympathetically driven or overdriven state on a regular basis. You just see people who are jumpy, who are just dysregulated and unhappy, and are having physical and emotional difficulties, even mental problems. and by mental problems, I mean cognitive problems. I'm not talking about, depression or anxiety, although those come along with it as well. You can just simply by interacting with them, see it and feel it. And then you have people who are more relaxed and more confident and more deliberate. And you can see that even though they have lots of energy and lots of confidence, they're not dysregulated by an overdrive of the sympathetic nervous system. They're more parasympathetically driven.
Last question. I was always curious why the brain disease dementia led to an early death, because I was isolating the brain as just like a thinking organ. And now we have updates that tinnitus and even Hashimoto's are not thyroid or tinnitus an auditory thing, but are brain dysfunctions. Can you comment on that pattern that's emerging?
Yeah, I think that's consistent with the general theme, which I think people are discovering, is that all diseases, all conditions have at their heart one or more of the four pillars being affected. Microbiome, people talk about degenerative neurological diseases arising out of the gut. They talk about, it might be bacteria or prions or other things rising up through the vagus nerve into the brainstem. I'm not saying that I agree with those specific mechanisms, but there's no question that the microbiome communicates with the autonomic nervous system, and that dysregulation of the microbiome affects the central nervous system, and that the mitochondrial function can be affected by the central nervous system and peripheral nervous system, and that it has effects on conditions like Alzheimer's and like other degenerative neurological conditions. I'm doing research right now with a team of people out at the University of Victoria in British Columbia on the other end of the timing of life spectrum of autism and schizophrenia. But most of the breakthroughs that are being discussed with respect to schizophrenia are applicable to Alzheimer's as well, because very similar pathology. But yes, there's no question that when you boil these conditions down, you're going to find, as integrative practicing physicians and healthcare providers in general are going to agree, that when you break them down, you get down to the point where you're talking about one of those four pillars. And we now know that the master regulator of those is the autonomic nervous system. So yes to Alzheimer's, yes to atherosclerosis, yes to fatty liver disease, yes to obesity, yes to autoimmune diseases, yes to cancer. Understanding that cancer is not in this absolutely, in my mind, relatively insane reductionist view that it's all about a mutation in a cell. Well, no, that's not what's driving cancer, because you can take the nucleus of a cancer cell and put that nucleus into a healthy cell, and that healthy cell will not become cancerous. So if it were simply a function of the fact that there was a mutation in the DNA, then you would assume that that mutation, if it's driving cancer in one cell, will drive it in another. It does not. However, if you take the dysfunctional and mitochondria out of a cancer cell and you put it into a healthy cell, that healthy cell starts to become cancerous. Now, if you're lucky, that cell will actually have its own mitochondria and will commit suicide, but it will not remain as a healthy cell. And so when we think about, well, what does it mean that you have unhealthy mitochondria driving cancer? Well, it means that it explains why cancer is far more prevalent in patients who have metabolic disease, high BMI. I mean, I'm doing some research right now showing that in some cancers, the difference in the incidence of cancer among normal BMI versus obese patients can be as much as 250% different. And you say, well, how is your weight affecting that? Well, it's because one of the pillars mitochondria are being affected, and that's leading to inflammation, which brings another pillar into play. And those two are dysregulating your microbiome, and they're dysregulating and your autonomic nervous system becomes dysregulated. So all of these things are related to one another. If you can figure out how to fix those four things and get those four pieces in play, and the easiest way to do it is by modulating the autonomic nervous system, every disease can be modulated, regulated, and potentially treated.
Great. You shared with me a very intimate and profound transformation of a student. I won't say her name. You can share it in your story. That was labeled delayed growth, delayed intelligence. You know, these limiting diagnoses that society loves to place on people when they don't really know what's going on. And you did vagus nerve stimulation on her, and the changes were just beautiful. Can you share that story with us?
I'm happy to, and I've actually had the opportunity now to share it and be specific about it. We're talking about one of my children. My daughter, my second daughter, she's a third child overall, but she was born with infant eczema that progressively got worse and had other symptoms associated with it that sort of emerged as she grew. By age 5 or 6, she was getting very severe headaches, stomach aches that would come along with them. She would typically get sick and pass out, or effectively just become so groggy and tired that she would fall asleep anywhere we were. By age 7, her teachers were identifying her as a person who was, quote unquote, a little slow. And I didn't believe it. I had opportunity to see her in action and didn't find her cognitively impaired in any way, but they suggested that she wasn't doing so well in school and that they thought that it might be an issue. I was more concerned at that point with her physical well-being, and I began using a vagus nerve stimulator on her. And the physical symptoms that she was experiencing resolved so rapidly that it's almost unbelievable. But I will tell you that within 72 hours, and she'll tell you it was in 48 hours, but within 72 hours, the literal physical plaques that were on her skin were gone. And the chronic itching and scratching, to the point where she would scratch in her sleep to the point where she was bleeding, stopped. And the headaches stopped, the stomach ache stopped, and she was experiencing these symptoms. The itching was all the time. The headaches and the stomach aches were 4 or 5 times a week. Went to zero. And when I say went to zero, it's not like it tapered. It was a cliff. It went from 4 or 5 times a week to zero in a matter of days. But what I didn't realize was that it was having an effect on how her brain was developing. And I've subsequently come to realize that brain development is actually, your brain is constructed by your immune system, by the immune cells that are resident in your brain. They're called microglial cells. They build your brain. And they build it not just in gestation, but all the way through until probably 20 or 25 years old. And in certain areas of the brain, like your hippocampus, they remain active all the way through life. That's how you can learn and gain new knowledge and make memories all the way through life. When they are inflamed, when they are activated into an inflammatory posture, they don't do the job that they're supposed to do. And so she was inflamed all the time. And as a result, her brain wasn't developing optimally. When we introduced the vagus nerve stimulator and dealt with that inflammation, it optimized her neurodevelopment in a way that I think exceeded, I don't know for sure, but I think it exceeded what a normal child would have. Because every child has inflammation. They get colds, they get scraped their knees, things that she existed in almost like a bubble where her immune system was being maintained in an optimal state for neurodevelopment. And she rapidly progressed. intellectually from that point forward. Within 6 months, she was the best student in her class. Within a year, she was the best student in her grade. Within 2 years, she was, as a young student in the lower school of the school she was in, she was being pulled out as the ambassador for the school when other students came to visit and parents came to visit. She went on to tell me that she was not satisfied with the rigor of the school she was in. By 5th grade, she was telling me that she wanted to go to the best school in the state. We accommodated that. She then spent the next 3 years as the valedictorian of her middle school, during which time, in those 3 years, she took 5 years of math. She's taken chemistry and other classes during the summer just to keep herself active. She reads law textbooks. She is truly an amazing kid, and I don't know whether or not, or what portion of her neurodevelopment is attributable to the vagus nerve stimulator optimizing her neurodevelopment, but I know that it's not zero, and I know that it certainly changed the trajectory that she was on. And so I think that's the story you're talking about, and I am happy to share that with people. It is an amazing observation, and it requires, it's an N of 1. It does not say anything dispositive, but when you look into the literature and you look to see other uses of vagus nerve stimulation for the treatment of epilepsy or depression or other things, what you find is that there is a cognitive improvement that is being systematically observed and documented. So mine's the personal case. There is literature out there to suggest that this is not simply just a dad who's saying nice things about his daughter.
Thank you. Beautiful story. So happy it turned out wonderful for your daughter and for your family, and the naysayers who maybe hopefully are inspired by her transformation.
Well, I want
I'd like to wrap.
everybody to be happier, healthier, and smarter, and to live as long a healthy life as they can.
Beautiful. I'd like to wrap up with what action step could you summarize as a takeaway message for the listening audience of today's conversation? What simple action step would you recommend?
I always tell people that the 3 simple things that we've known about for thousands of years, that everybody talks about, are diet, sleep, and exercise. You can't deny the fact that those 3 things are absolutely the top 3 when it comes to being healthy, and understand that we have a machine. We've been gifted the most complicated machine in the history of the universe with no instruction manual. But we figured out that good diet, healthy amount of exercise, and restful sleep are really important things. But there's a 4th. And the 4th thing that I think we've gotten away from, especially in Western society, is the idea that you can spend some portion of your day in stress, but you must spend some portion of your day in the rest, digest, and recovery mode. And that is activating your parasympathetic state. We have to do that. We have to get away from being on 24/7. We have to get away from being under the gun and simply sliding from one pressured situation to another, whether it's work, relationships, politics, society, finances. We have to find time away from those stresses to get back to rest, digest, and recovery. And if we do that, life is so much better. And so I add it to diet, exercise, and sleep. I add get your rest, digest, and restore and recovery mode fill of the day. Make certain you do that. And vagus nerve stimulation is a great way to do it, but there's others. There's meditation, there's positive social interactions, there's deep breathing exercises, there's cold plunges. There's all sorts of different things you can do. Cold plunges. I live down here in Florida, and you're out in California. Cold is something we try to avoid if we can, but it's good for you.
Thank you. Last note, gratitude. It's been said that the key to abundant energy is through the heart and a state of a feeling of gratitude. What would you say or like to share with the audience you're thankful or most grateful for on your journey thus far?
You're absolutely right. And when I talk to people, gratefulness and gratitude journaling is one of those things that so many people roll their eyes at. And I as soon as I see it, I stop the conversation. I say, I want you to understand that they have done studies in patients with chronic heart failure. These people are going to die of heart failure, and they have broken them into two groups. One group that does gratitude journaling every day, and the other group didn't. And the group that lived longer, and not just by a little bit, but by lots, was the group that did gratitude journaling. I guarantee you that that is probably more powerful than a lot of the things that you're doing that you think are really healthy. Okay. So gratitude journaling is important. And for me, I take the time on a regular basis to reflect on the joys that I get from being a dad, the time that I get, and I'm not saying it was given to me, I earned it, but the time to go to the gym, the time to spend alone thinking about things that I enjoy thinking about, as opposed to, what other people are demanding of me. I am very grateful for being able to live in the United States. I mean, there's a lot of people out there in the world who want to come to live in the United States because they recognize that for all of our flaws, we're a great country. We have freedoms and we have wonderful opportunities that other people don't have. So I'm grateful for that. And I'm grateful for wonderful people like you who are on the same team with me, and we're working together to bring this good news, if you will, to the world.
Well, thank you, JP, for sharing your mind, your heart, your family stories, your research, your dedication to the world and with this podcast and the audience here. How can people follow or find out more about you if they would like to dive in deeper?
Sure. So the three best ways are to follow me on Instagram. I try to be communicative on Instagram. I'm the VNS guy. So it's THEVNSGUY, the VNS guy. And then you can also go to jperico.com. And when you're in the mood for listening to podcasts, and you've gotten through this one, if you want to stop by the Health Upgrade podcast, which you've been a guest on as well, it would be wonderful to have people come and check out what we talk about there. And soon, as a fourth final bit, I'll say very soon I will be launching a YouTube channel, which is called The Science Corner, where we discuss the science behind topics in health, wellness, and longevity. And people should tune in and check out the knowledge that we're going to be dropping there.
Wonderful. Thank you so much for being part of today's episode and the beginning of the self-care revolution. Thank you, JP.
Well, thank you for having me. Have a great day.
Thank you.